Hello, my name is Alicia Stokes. Here's my identification. Today, I will be evaluating the effectiveness of smart recovery in substance use treatment. SMART recovery stands for Self-Management and Recovery Training. It was founded in 1994, which incorporated a science-based alternative to the traditional 12-step program. Instead of relying on a spiritual foundation like the 12-step program, the SMART program uses evidence-based tools that are rooted in psychology. In addition to cognitive behavioral therapy, there is a 4-point program. The first point is motivation. The goal is to help individuals find strong personal reasons to stay sober or free from addictive behavior. The tools needed encompasses clarifying values and setting short-term goals with the understanding of the pros and cons of using versus not using. Coping is the next point, and this point helps with handling cravings and triggers. The goal is to learn strategies to resist urges and reduce the power of cravings over time. Tools include delay, distract, and decide techniques, deep breathing, and relaxation. The purpose of this is to build confidence in staying substance free during challenging moments. Next is managing thoughts, feelings, and behaviors. This step teaches a tool how to manage them in healthier ways, how to manage triggers. The goal is to understand the connection between thoughts, feelings, and actions and how to change them. The tools include ABC tools, which is identifying a triggering event, beliefs about it, and the consequences. Cognitive restructuring, which requires you to challenge and change negative thinking. Problem solving techniques are also tools used when managing thoughts and feelings. The purpose is to replace harmful patterns with healthier, more productive responses. Last is living a balanced life. The goal is to develop routines, relationships, and activities that support wellness and fulfillment. The tools include time management, setting priorities, rebuilding relationships, pursuing hobbies, education, or career goals. The purpose is to create a lifestyle that reduces the desire to return to addiction and supports personal growth. How SMART recovery works. SMART recovery meetings are designed to provide a structured yet flexible approach to addiction recovery. Each meeting typically begins with a warm welcome from the facilitator, followed by introductions where participants may choose to share their names and reasons for attending, although sharing is always voluntary. After the introduction, participants engage in a check-in, offering brief updates on their progress, challenges, or goals since their last meeting. The focus of the meeting is usually surrounding a recovery or tool form of SMART, such as managing emotions or cravings. Meetings conclude with a checkout, where members may reflect on what they've learned or share a commitment for the upcoming week. The application of substance use treatment. Smart recovery is used in many different places, like outpatient programs, residential treatment centers, jails and prisons, hospitals, and community health clinics. These meetings give people a safe, supportive space to talk about recovery and learn helpful skills. One of the great things about Smart Recovery is that it works well with other treatments. For example, it fits with therapy like cognitive behavioral therapy, motivational interviewing, and even medication assisted treatment. Counselors often recommend SMART meetings as extra support after someone finishes formal treatment because it's science based and not connected to a religion. Smart recovery can work for many different people and treatment plans. Now I'm going to get into some research findings, and I'm starting with Heravath and Yetterin research findings, um, which reviewed how smart recovery works and how it helps people recover from addiction. The authors explained that smart recovery is different from 12-step programs because it focuses on self empowerment, practical coping skills, and scientific approaches like cognitive behavioral therapy. Participants in Smart Recovery reported several key benefits: increased self efficacy. People felt more confident in their ability to manage cravings and stay sober. They developed improved coping skills, learned tools to help deal with stress, triggers, and negative emotions. Many participants, like the Smart Recovery, encourages them to take personal responsibility for their recovery rather than relying on a higher power. Additionally, the Smart Recovery program is helpful for people with many different types of addictions, including alcohol, drugs, gambling, and other behavioral issues. Another research finding was presented from Beck. Beck and colleagues conducted a randomized controlled trial to evaluate how well smart recovery works, especially for people dealing with both addiction and mental health issues, simply people who have dual diagnoses. The study found strong evidence that smart recovery is effective in these cases. Beck's findings include reduced substance use. Participants who attended the Smart Recovery meetings showed a significant drop in their use of alcohol and drugs. Findings also suggest that participants develop better mental health. Those with recurring mental health conditions, such as depression and anxiety, also reported improvements in their emotional well being. Beck also indicated an increase in empowerment and self management. The study highlighted how SMART's focus on self reliance, goal setting, and managing emotions help participants feel more control of both their addiction and mental health. The last research finding comes from Blatch. Blatch research finding was more of a structured environment, but also a flexible program. The program offered a structured meeting format that was easy to implement in prisons while still allowing for open discussion and personal sharing. It also included skill building. Inmates developed important life skills like managing cravings, handling stress, and making better decisions. Blatt's research showed lower relapse and recidivism. Participants who attended Smart Recovery meetings in prison were less likely to relapse or return to prison after release. Blatch also found a community and connection. The program helped build a sense of peer support and accountability among participants. Group members also supported each other's recovery journey, reducing feelings of isolation and increasing hope. A sense of empowerment was also identified. Smart recovery gave individuals the tools to take control of their recovery, even in restrictive environments like prison. A synthesis of evidence. Research across multiple studies support the effectiveness of smart recovery as a non-clinical intervention for substance use treatment. Horvath and Yetterin found the participants in smart recovery reported improved coping skills and stronger self-efficacy. The program's use of cognitive behavioral therapy and tools helped individuals take more control over their recovery process. Beck and colleagues expanded on this by showing that smart recovery is especially helpful for individuals with dual diagnoses, those dealing with both substance use and mental health conditions. Their randomized controlled trial found significant reductions in substance use as well as improvements in mental health outcomes amongst participants. In correctional environments, Blatch demonstrated how smart recovery supports incarcerated individuals by teaching practical recovery skills and building a sense of community. Their study found lower relapse and reoffending rates among inmates who engaged in smart recovery, showing this positive long-term impact. Together, these studies highlight smart recovery as a flexible, evidence-based option that works across a variety of settings, from community groups and outpatient clinics to prisons, and is effective for both general and complex cases, including co-occurring disorders. Recommendations for counselors. To effectively implement smart recovery in clinical settings, counselors can start by introducing the program during intake or early sessions, especially for clients seeking a non-spiritual, evidence-based support option. It's helpful to provide printed or digital material and connect clients with local or online smart meetings. Clinicians should consider incorporating SMART's 4-point program into treatment plans, aligning therapeutic goals SMART with building motivation, managing urges, and improving coping skills. Partnering with trained SMART facilitators or inviting guest speakers can strengthen integration. Finally, encourage clients to track their progress using SMART tools like the ABC Activating Event Belief Consequence worksheet, which contem- con- complements cognitive behavioral interventions already used in therapy. Thank you for your time, and I am willing to accept any questions on this presentation.